Hi, my name's Greg Fell. I'm Director of Public Health in Sheffield. This is a situation report for Sheffield today, the 9th of December. Firstly, the epidemiology, the 7-day incidence rate is coming down pretty quickly now. As of yesterday, the 7-day incidence was 130 per 100,000. Just a week and a half, 2 weeks ago, it was closer to 300 per 100,000. So it's coming down really quite quickly. Our analysts are very excited because they can get the green pen out now. We'd had a threshold of 150 per 100,000. Which is where we begin to think we're definitively the trends are going in the right direction. They are, and the green pen is being used, which is good news. Positivity rate is 6%, and again a couple of weeks ago positivity rate was 12-13%. So of 100 people who have symptoms and get a test, 6 of them will test positive, and a couple of weeks ago that was 15 of them. So again, good news. Hospitalisations is still not so good news. There are still significant numbers of people who are poorly in hospital with COVID, and that's coming down at a very, very slow rate. Not very fast at all, and that will be a key problem as we go into the next couple of months. I have no doubt. So to use a phrase, the bath is pretty full. The taps have been largely turned off, but not wholly turned off. But the bath is not draining very quickly, and there will be some very poorly people in hospital. Arguably, they're people who would not have survived, and that's great for them, but they remain in hospital for a lot longer. So hospitals are still quite pressured. That puts us into, epidemiologically speaking, keeps us in quite a tricky position because we've got an R0, which is just below 1, 0.9 to 1 is the current estimate. A 7-day rate of infection that is coming down, actually coming down quite quickly, and it's also coming down in the elderly quite quickly. Again, it's below the threshold, but still high, much too high, certainly much higher than it was earlier in the summer. And the hospital that is busy, is busy doing the things it normally does at this time of year, but it's also busy with people who are very poorly with COVID. So the three of those things put together sadly make our room for manoeuvring very, very, very limited. So we are being very careful in the run up to Christmas. We all anticipate that the mixing that will happen at Christmas as we celebrate Christmas will have an impact on that one. The last thing that anyone wants to see is a significant takeoff in infection rates again, but that is a very, very, very real risk. So my ask to Sheffield is to be very careful about how you celebrate Christmas. The pandemic is not over. It has a long, long way to run. The last thing that is just worrying me a little bit is that we're beginning to see a slight uptick in the number of outbreaks that are happening in lots of different settings. There's no single space that worries me, but lots of different settings. And now they will be managed, but outbreaks are a sign that we're beginning to let our guards down and beginning to let our hand washing and our distance practices slip somewhat. And again, I'll kind of remind everyone that the basics remain the basics. And the key way to reduce risk of infection for you, me, everyone else is to wash hands frequently, keep distance, wear face coverings, and limit the number of people that you have social contact with in households and otherwise. And that will keep the level of virus at as manageable a level as possible and hopefully continue to go down for the foreseeable future.